old, and I put this presentation together very, very quickly. So I am here to answer any and all of your questions. And this is just kind of an overview of, everything about the specialty and just about my journey. And I hope it's helpful to you guys. So I wanted to start off with just this quote, the days are long, but the years are short. They say this a lot to mothers, but I think it's true for us in medicine too. And as you start your journey into this path, I really think that you should remember that. When I look back and, doing presentations like this just makes you think about the journey and everything that you've been through. And, you just really need to enjoy every moment of it, because every part of this process is really exciting and just special in its own way. So I hope that you guys will enjoy every moment. And I know it's stressful. I know every single, part of the process feels stressful, but you'll get through it. And if you work hard and take care of yourself and enjoy the moment, you will get where you want to be ultimately. So, so the overview of what I'll kind of be going through is my journey a little bit, choosing your path, what's allergy and immunology as a specialty, a little bit about global health, because I have a little bit of experience in that also, and then telemedicine. Okay, so my journey, this is just a laundry list of everything that you have to go through to get to medical school, get through everything and get to where you want to be. So I went to undergrad at the University of Michigan, and I majored in biopsychology and religion. Biopsychology is a particular major at University of Michigan that a lot of people do. It's a combination of basically how the brain affects psychology. And then I did religion just so I could have something else to focus on besides just the medical classes and the pre-med classes. So then I went to medical school at Michigan State. So as you can tell, I'm from Michigan. I grew up in Michigan. I am an immigrant. I was born in Africa, actually. And yes, I am Indian, but there's a lot of Indians everywhere, but definitely in Africa. So I was born in Africa. My family came here when I was around 6 years old. I went to kindergarten in New York, where we first landed. And then my father, who is actually also a physician, ended up getting a residency position in Michigan and at Michigan State. And that's where he did his training. And so, I went to University of Michigan, then I went to Michigan State College of Human Medicine for my medical school, which was a great place to train. Actually, they have a combination of just not really great, very good, not only great academics, but also just this human aspect to the education that I really, really loved. And what that means is just that they were really, they're very focused on the doctor-patient relationship and how you can make that better. So I really enjoyed my education there. And then I did my residency training at Rush University Medical Center in Chicago, another wonderful place to train. I really, ultimately I'm a city girl, and I realized that just as I was in undergrad, and I thought I was going to go to New York, and then I realized that Chicago was kind of a nice medium in between, and it was a great place to do residency. And I did my residency in internal medicine and pediatrics, and I'm going to talk about that a little bit more, something called Medpeds. And then I did my fellowship training at Downstate Medical Center in New York. So I did make it to New York City, which is where I still am. So, choosing your path in medicine is not an easy thing to do. There are so many choices as you're learning through Socially Distanced Shadowers, which is a great program. but there's so many things that you can pick from. And so it will feel overwhelming. It will feel like a huge decision that you're making. And so that's why you really want to understand what you're getting into. And you really do want to shadow and shadow and shadow and really, really get into the weeds of what you think you want to do when that time comes. And I think starting early, if you really think that you know what you want to do, starting early and really getting experience is the best way to do it. And you have to remember that there's so many different ways to practice every field of medicine. There's academic, there's private practice, and then there's also telemedicine now. And so even, that's why it's so important to shadow, even within the specialty that you're thinking about going into, shadowing multiple different practitioners to see how they're practicing that particular field can give you a different kind of viewpoint into what you might be getting into and what the what you can do with that career. So I would just say, as much as you can, to take the opportunities that you are presented with and get as much experience into whatever field you think you want to be in. And then you also probably find a mentor while you're doing that. And I think mentors along the way are just so important. Finding that person that you can reach out to when you're confused about any part of your path is so important. And I have so many mentors that I look back on and I'm just so thankful for. So I think just, shadowing not only gives you an opportunity to see what the field is like, but to also hopefully find a mentor that you can really lean on as you're going through all of this. And then, always remember that within any specialty, you can really choose one area to be focused on, and you can be the specialist of the specialist in that one area. And I'll talk about all the areas that you can treat as an allergist immunologist. And, some people choose to just really focus on one area of that specialty, like asthma only, or immunodeficiencies, or, all of the things that I'm going to tell you guys about as far as allergy and asthma goes. And so, you can do, you can focus on one area, or you can just practice the broad area or the broad field within that subspecialty. So what is Medpeds? I kind of mentioned it briefly. Medpeds is a combination residency program where you do both internal medicine and pediatrics. So internal medicine, is the practice of medicine from 18 and above, and pediatrics is from birth to 18 technically. And so, normally those are two separate residency programs, and they're usually 3 years each. But in Medpeds, you actually do a 4-year program, and you get trained in both of those fields, internal medicine and pediatrics. And what that means is that you can actually take both board exams in internal medicine and pediatrics and become a board certified internist and pediatrician. So, and, why is that different from something like family practice, for example? So family practitioners are actually trained not, throughout the ages, so you can practice from birth until somebody dies. And they also, family practitioners also do a little bit of OB sometimes. And the biggest difference is that through Medpeds, you can actually subspecialize in any medical specialty within either internal medicine or pediatrics. And so really for me, the reason that I did Medpeds was because I really wanted to treat, a broad spectrum of people. I wanted to be able to treat kids and babies and teenagers and adults and older people. So I really wanted that training in all age groups. And then in addition, I knew that I probably wanted to subspecialize. And early on, I went through a lot of different kind of ideas on what that specialization might be. Oncology, which is, the practice of seeing patients with different forms of cancer, or, pulmonary, which is just focused on the lungs. And then I really, I realized oncology wasn't for me because unfortunately, when you're practicing with cancer patients, there is a lot of death, and unfortunately, you will experience that more often within that specialty. And so I realized early on that that wasn't really something that was going to work out well for me and my personality. I tend to, you know, when I realized throughout my training that when I had the experience with death, it just really affected me, and I would take it home with me more than some of my peers. And so, you know, that's something that I always tell medical students to think about, pre-meds to think about, or anybody who's thinking about going into medicine. I think it's just something to really understand about yourself and to kind of be aware of yourself and know what your everyday is going to look like and how that might affect you personally. And so anyways, I decided that oncology, as much as it was interesting to me, just wouldn't work for who I am as a person. And then I very much liked the lungs and pulmonary, and so then I was thinking about maybe just specializing in lung medicine, which is becoming a pulmonologist, but that didn't feel right either, because then I felt like, oh, I want to treat other areas of the body too, and so that's how I fell on allergy and immunology, because number one, I think my next slide actually is a good one. So, you know, within allergy and immunology, you see patients across all age spectrums. So you see both adults and kids. So what's interesting about the specialty is that if you come from an internal medicine background, or if you come from a pediatric background, you can actually go into allergy and immunology. And once you go into allergy and immunology, even if you've only been trained in internal medicine or only been trained in pediatrics, you will actually end up seeing all age groups. So for me, once I really realized that allergy and immunology was something that I was thinking about, I thought Medpeds would be the perfect way to get that baseline education, so that I would feel comfortable seeing patients that are both adults and kids. And so you will see both adults and kids, and really you treat patients from head to toe. And I'm going to talk about some of the conditions that we see. And again, there's so many different ways to practice every field of medicine. You can do outpatient, which, you know, a lot of allergists are mostly outpatient doctors. And what does that mean? That means that we don't really go to the hospital. We have a clinic. We see patients within a clinic setting. And we don't tend to see patients that are hospitalized. However, that doesn't mean that as an allergist, you can't see patients in the hospital. You can, and those are usually physicians that are academic physicians and working in an academic setting. They will see patients within the hospital system, or if a hospital system is, you know, is also hiring for an allergist just to see their inpatient patients. And so, or you can do a combination. And that's kind of what I was doing. I was seeing a lot of patients outpatient. I was in a clinic, but then I also became affiliated with a large medical center. And actually in New York City, I am affiliated with Mount Sinai and with Downstate, where I did my fellowship in allergy. And so in that way, I had the ability to be mostly outpatient, but also be able to do some teaching with the fellows that are learning to become allergists, and also precept their clinics. So once a month. So there's ways to, you know, have everything actually that you want. You just have to be creative in the way that you kind of find your path and create your career. And so getting into a little bit about some of the conditions that allergists treat. So, you know, starting at the top, we do treat the nose and the eyes, and that's called allergic rhinitis and conjunctivitis. So rhinitis is the nose. inflammation of the nose, and conjunctivitis is inflammation of the conjunctiva of the eyes. And so, usually allergic rhinitis and conjunctivitis is caused by an environmental allergen. Triggers like trees, grasses, weeds, dust mite, cockroach, cats, dogs, mold are examples of things that can trigger an allergic reaction that causes inflammation of the nose and the eyes. And And that particular form of testing is called skin prick testing. And this is one of my patients whose test results you can who you can see has all these little bumps on their arms. And yes, I actually caused these bumps by doing the skin prick testing. And so each of these bumps is a different allergen that we place on the skin, and we prick it in the top layer of the skin. So it doesn't actually go into the person's body in any way. It's just literally just you take the allergen, which is in the form of serum or the proteins that the person will be allergic to in trees or grasses or weeds or dust mites, and you prick it on the top layer of the surface of the skin, and it causes inflammation, or it causes a histamine to be released, which is what an allergic reaction, the main trigger, the main inflammatory kind of mediator for an allergic reaction. And it causes histamine to be released, which causes this inflammation to form. And this happens within 15 minutes. So this is really how you find out if somebody is allergic. So this person was very allergic. Some people that if they're not allergic, then when I do this testing, they won't have any bumps on their arms after 15 minutes. So, skin prick testing is kind of the bread and butter of being an allergist. And so if you guys have any questions about that, I can obviously answer, but I'm just briefly going over some of the conditions that we treat. So then there's also asthma. So the great thing is that, as I told you guys, I was very interested in the lungs, and within allergy and immunology, I get to treat conditions of the airways or asthma. And so asthma is actually not just one condition. There's lots of different types of asthma. There's adult onset asthma, allergic asthma, there's the asthma COPD overlap, there's only exercise-induced asthma, there's also non-allergic asthma, there's occupational asthma, and then there's a newer one that we've kind of really focused in on over the last several years, which is called eosinophilic asthma. And so, when the cool thing about medicine is that it's constantly changing. So as you get into your, further into your career, you will realize that that essentially you will be a lifelong learner. And that's, sometimes it can feel frustrating, but then at the same time, it's amazing because medicine's always advancing, and we're seeing that right now very, very acutely with COVID and all of the, fast learning that is going on, and how much we've learned from March until now is just amazing. And so that's happening all the time within medicine. And you will be a lifelong learner for forever. And it's exciting. It's sometimes, like I said, frustrating because it just feels like you're never going to leave the books, but it's fun because we are able to find new treatments for our patients and help them feel better and, improve their outcomes. And so one of the things that I wanted to talk about was, within asthma and that eosinophilic asthma type, there's new medications called biologics, and biologic treatments, which again, we're using a lot in COVID also, are treatments that target antibodies, inflammatory molecules or cell receptors within our body. And by targeting those particular receptors or antibodies, we can disrupt the pathway that leads to that ultimate disease. And so, there are a number of biologics for the treatment of asthma, and it's totally revamped what we can do for our asthmatic patients. And for asthma, the biologics are injectable treatments. So there are injections that the patient will take either every 4 to 8 weeks, depending on the treatment, or sometimes it's actually an IV infusion. So, that just being said, very generally, I'm not going to go into, all the different types of asthma treatments or anything, but I just wanted to tell you guys this because it's exciting. It's exciting that we are constantly learning and constantly improving the way that we can treat our patients. And asthma is just one example of that for me and my career in allergy and immunology, and how far it's come from even the last 10 years of me practicing allergy as a full-fledged attending. Then there's also, we treat conditions within the GI tract or the gastrointestinal tract. There's something called eosinophilic esophagitis, and that's essentially caused by a large number of eosinophils. Eosinophils are a type of blood cell that causes inflammation and causes irritation in our body. And when eosinophils are present, it can be allergic. And so allergists work with GI doctors or gastroenterologists to do testing for foods to see if that might be a trigger. So this is a picture that I got from AAFP.org, and it's showing a normal esophagus from a endoscopy, and then it's showing an esophagus that has EOE. And so you can see that, there's obvious changes, there's changes to the structure, and then you can see that there's a lot of inflammation and irritation present within the esophagus. So obviously inflammation, irritation is not good. It can cause, so the symptoms of eosinophilic esophagitis are things like patients will come in with feeling that food constantly gets stuck. They can have a food impaction because of all the inflammation. The food can get stuck there, which can obviously be very dangerous. And so, we use anti-inflammatory medications. And then if they're allergic to foods, then we also use avoidance measures to treat EOE. And then we also treat conditions of the skin. So one of these conditions is urticaria. So urticaria is a skin condition caused by the release of histamine. So again, the main kind of inflammatory mediator of allergic conditions is histamine. And so you can see here, essentially they're welts that form on the skin. They cause itching, a lot of irritation. And, this figure kind of shows this person just having it on her back or on her shoulder, but this can actually, I have patients that have come into the office covered from head to toe with hives. And you can only imagine, not only is it can be disfiguring, but just imagine being itchy from head to toe. It leads to sleep issues. It leads to the inability to work for some people, and just in general, discomfort, anxiety, and for some people, even depression. And so there are ways to treat this. And actually, there are biologics even for urticaria treatment. So there's, depending on the severity, we choose the type of treatment. And then there's acute, meaning forms that happen rapidly or that come and go quickly. And then there's chronic urticaria, which is a patient kind of has hives for 6 weeks or longer. That's considered chronic. And that means that it's not, acute urticaria you can get from an allergic exposure. Like if you're allergic, like for example, I am very allergic. That's another reason that I chose allergy as a specialty. I have environmental allergens, so I understand what it feels like to, go into someone's home, they have a cat, and to be instantly become irritated and uncomfortable. I also have asthma, so I understand what that feels like. And so, but with, acute forms of urticaria, that can happen if you're exposed to something that you're allergic to, like a cat, or with chronic forms of urticaria, that can sometimes not even have a specific trigger. It can be what we call idiopathic, which means that there is no trigger that's identifiable, and that it's just something within your body that's causing you to become hyperreactive and release histamine abnormally. So anyway, that is, a part of what I do is to try to figure out, is it acute? Is it chronic? Is there a trigger that we can get rid of, or is it more just internal and something that we have to manage with medications? And then actually anxiety can also cause urticaria. So is it something that we need to talk to the person about their stress levels and how to mitigate some of that stress, because that can actually help with their hives also. And then there's eczema. So eczema can also be non-allergic or allergic. And eczema is an inflammatory condition of the skin. It causes irritation, dry skin, scaling. It can be found all over the body. This is just a picture of one of the most common areas where it affects people, which is right in that crease of your elbow. Your antecubital fossa. And so, I've also have patients that come in that have such severe eczema that they're affected from head to toe. And even for eczema, we have biologic treatments now that can help those severe patients with their eczema, as well as topical treatments like topical steroids, hydrocortisone, and other forms of topical steroids that we can use for these patients. So, again, my job is to see, is it allergic or is it non-allergic? Can we get rid of a trigger that might help? Can we do something called immunotherapy? So for both allergies of the eyes and nose, some people think that immunotherapy can help with eczema too. It can definitely help with asthma, but immunotherapy very quickly is where we take the allergen and we slowly help the patient's immune system recognize that the allergen is not something that it should be reacting to, and something that is not a danger to the body. And that's done by small exposure in a very particular way. We give, you can do allergy shots, or you can, there's actually also sublingual therapy for environmental allergens, and now there's also oral immunotherapy for food allergens. So again, this is a lot to cover, and I don't know, I hope I'm not getting too much in the weeds, but I'm just kind of giving you an overview of the kind of things that we do as allergists. We also work a lot with the immune system and find conditions like immunodeficiencies. So this is, I thought that this was a really good chart that I found from Dr. Harsano, and essentially, it shows you that immunodeficiencies can be primary, which means that, someone is born with them, or they can be secondary, resulting from things like HIV, malnutrition. Certain drugs can cause immunodeficiency, and it's, to back up a little bit, immune deficiency is just when your immune system is not working properly. And so our focus as allergists is more on this primary immune deficiency disorders. And, there's more than 100 primary immunodeficiency disorders. A lot of them happen, at birth and are found by academic allergists that work within the hospital setting. And so, after the fact, I will manage immune deficiency patients within my clinic once they've been diagnosed, or there's also immune deficiencies that present later in life, where I will see a patient who gets frequent infections and evaluate them and see if they might have one of those immune deficiencies that didn't necessarily present as an infant, but that presents later on as you get older. And then another kind of immune system related disorder that we treat is food allergy. So I think everyone has a friend or knows somebody that has a food allergy, I think at this point. We do in more developed countries have, obviously, some people call it an epidemic of food allergy, where there is just a lot more people being diagnosed with food allergies than there were maybe 20, 30 years ago. And so there's a lot of research being done into why that might be, and we're not exactly sure what is causing that increase in food allergy, but we do know now that early introduction of food, for example, so for my 5-month-old, I've already started introducing things like peanuts and eggs and things like that. So starting early with some of the more allergic foods, and these are the most common food allergens like peanuts, tree nuts, fish, shellfish, soy. Those things are the most common things that trigger allergic reactions. Milk. What we do again is we test patients to see, are they allergic? So if they come in after, for example, eating something with shrimp and peanut sauce, and they have an acute reaction, which is called anaphylaxis. And that's when, you eat something that you're allergic to and it causes the release of histamine and other mediators that cause inflammation very quickly throughout the body, and it can be life-threatening and very, very scary. So, food allergies that are mediated by IgE or IgE food allergy that's very different from a food sensitivity. And so those two things really, we need to figure out, is it a true food allergy? Does the person need to carry an epinephrine device around with them? Or is it more of a sensitivity and they should be fine if they just avoid and if they're inadvertently exposed to it, they're not at risk of death. So that's really what my job is as an allergist, is to figure out, is it a true food allergy or is it a sensitivity? And if it's a true food allergy, then the patient needs an epinephrine device that they can carry around so that they stay safe if they have accidental exposures. And now, as I said, medicine is always advancing. And now what we are finding is that there is now we can treat patients with something called oral immunotherapy for specifically peanut allergy is one of the things that we have an FDA approved treatment for. However, allergists are treating other food allergies with immunotherapy, but we need more data on the right protocols and things like that. But that's what these doctors are working on, is they're testing out their theories and they're writing papers. And I think within 10 years we'll have, or even actually probably earlier, within the next 2 to 5 years, I expect that even food allergy and the way that we're treating food allergies is going to continue to drastically change. And then now kind of shifting away from allergy. So that was a broad overview of what an allergist immunologist does. I wanted to also talk about my journey within global health a little bit, because I've had I've always had an interest in, number one, I love to travel, and I love to see how other cultures live and to experience other cultures and to see how their healthcare system works. So from very early days, actually, even when I was an undergrad, I couldn't pull up all of those pictures because I'm older and a lot of my pictures are actual pictures and need to be scanned into a computer. But when I was an undergrad, I did also have the opportunity to go to Ecuador and experience it was a infectious disease kind of program for undergrad students. Well, actually it was for medical students, but somehow I weaseled my way into the program. And I was able to learn about the health system in Ecuador, and we were able to do some help. I was able to just kind of shadow and help with some clinics that we did there. And from there, I've had so many more experiences. And these pictures are from this one in particular is from Haiti. After the earthquake, I was fortunate to be able to go there 7 weeks after the earthquake to help. I was only there for about 10 days with International Medical Corps. It's one of the organizations that does a lot of relief work in other parts of the world, just similar to Doctors Without Borders, similar to Partners in Health. And so I signed up and was able to go to Haiti for 10 days. And that experience was definitely eye-opening, definitely something that I will never forget. It's just, you know, I say all of this just to say that my training in internal medicine and pediatrics allows me to be able to go to other countries and help when I can, and, you know, work with organizations that are there in the country doing the work that they do to help long-term, which is really important. You know, you can't go in as a physician and just, you know, help and leave without somebody being there to kind of take over the care that you've provided. And so just been really fortunate to work with some of these organizations. And I say this just to tell you guys to seek out opportunities like this. I know that right now with COVID and everything going on, it feels like we're never going to be able to travel and we're never going to be able to have these opportunities, but I know that's going to change. And when it does, you know, I really would suggest that you look into doing something and finding opportunities. And a lot of the times when I was able to go, like for example, when I went to Haiti, my airfare, they took care of me. Everything was paid for because I was willing to go out there and help. And so it's not always something that has to be cost prohibitive. There's also, so when I was in medical school, I applied to grants through different societies. So like the American Academy of Pediatrics has a grant. A lot of the bigger associations have grants for pre-meds medical students where you can apply, write up a proposal and tell them why you want to go abroad, and they'll help cover some of your costs. So that's just to say to be creative and to think about ways that you can have those experiences that you might be interested in. There are ways to do it. And then this picture is from Nepal. I did something that is very unusual. After I finished my, medical school, I went straight into residency. After I finished residency, I went straight into a fellowship program for allergy and immunology. And once I finished that program, I decided, and at that point, you know, I could have just gone out, found a job, started practicing allergy and paying off some of those student loans. But what I decided to do instead was take a little sabbatical. And I decided to work with a couple of different organizations that I researched, and I booked kind of a one-way ticket I thought it was going to be around a year. It ended up being about 18 months that I was gone. And my first stop was Liberia in Africa, where I spent about 4 months in a small rural town working with an organization to try to help their hospital improve the care that they were giving to patients. And then next I went to India, where I was able to work with a large hospital and help, again, improve some of their systems and do some education for medical students in India. And then I also went to Nepal, and I was in Nepal for about 7 months in a very, very rural area. And these are some of the nurses that I was helping to teach. And this is one of my friends actually that I met at a conference, at a pediatric conference, who found out that I was in Nepal and working out there and asked if she could come out to help too. And so she came out, and that was actually really wonderful. But she came out, and we were doing some basic neonatal education for the nurses to tell them how to resuscitate infants when they're first born. So that experience was something that I'll never forget. And so I say all of that to, again, say that sometimes you just have to think outside of the box. And I think in this country more than others, people just kind of follow a strict path, and sometimes you don't have to. Sometimes you can get off of that path and, not go straight from, you can take a break at any point in the process. But that's just something that was life-changing for me, and something that I never look back and regret, never, ever look back and regret. And, I did, obviously, like I said, I could have been working, I could have been making money. Maybe I would have bought a house sooner, maybe I would have done so many things sooner, but I would have lost out on all those experiences. So just some food for thought for you guys. And that experience, if you guys have any questions about how I kind of went about organizing it, I'm always open to answer questions. And then recently, as I said, things are constantly evolving in our lives, and we're changing as people, and we're changing the way that we're living right now has changed drastically for everybody. And for me, I went from so when I got back from my travels from that year and a half working abroad, I decided to I went into practice with a couple of different allergy practices. So I worked for about 3.5 years at one large allergy group, and then I worked for another almost 4 years for another group that was both an allergy and an ENT practice, ear, nose, and throat practice. So, and that was all outpatient. I was doing some of my academic work with Downstate and Mount Sinai, but I was just mostly within a clinic setting in New York City, seeing patients. And then when COVID hit, things kind of changed. I actually started consulting with a couple of entrepreneurs in 2019 that wanted to do something in the allergy space and create something new in the allergy space. And from that consulting process, once the pandemic hit, things kind of ended up getting, things changed, and our company was starting to grow. The clinic that I was working for wasn't being as supportive as I needed them to while I was pregnant. So I was pregnant during the heart of the pandemic, which was very scary. And so then I actually decided in the middle of the pandemic that I was going to leave my clinic practice and start working full-time on this online allergy clinic or telemedicine practice. So if you guys aren't familiar with telemedicine, it's the practice of caring for patients remotely, where the provider and the patient, the doctor and the patient, are not physically present with each other. So I think everyone's heard of telemedicine, but I wanted to mention this because, again, you can think outside of the box. You can figure out a way to evolve and to change your career path at any time. There's so many different ways that once you get your degree in medicine that you can practice medicine. And so will I only be doing telemedicine? No. Right now, it's been great because I've been able to be at home with my son and still care for patients, but I do plan to go back into the office. So there's a way to do both. And then, this is obviously a very special opportunity that I got, and now I'm a co-founder for this company too. So it just worked out in weird ways, and that's how life is. It works out in weird ways, and you have to listen to yourself. You have to always be open to change and different opportunities. So that's where I'm going to end. I hope that was helpful, and I'm open to any questions you guys have.
Thank you so much for the session. It was super informative, and everyone loved your experiences and your honesty with sharing your life journey. So thank you so much for that. There were a ton of questions, so we'll try to get through some of them. We have about like 10 minutes. So I think one of the questions that a lot of people had was with allergies and COVID. Do you foresee, or like, have you heard of any allergic reactions to the COVID vaccine? Do you foresee any in the future? Will this change people's allergies? Kind of what are your thoughts on that?
Yeah, so again, medicine's always changing, and this is something new as an allergist that we have to learn about and be aware of. So COVID vaccine allergies are becoming more of, like, I would say, a hot topic within the allergy field, within medicine, for obvious reasons. And we don't know enough yet, okay? And so I don't want people to be worried. Vaccine reactions are in general very rare, but I think because we're vaccinating so many people, and because this is so much in the media, we're seeing every single reaction that's taking place. And I think sometimes in the media it's not captured in the right way, and it's kind of blown up and it's made out of proportion. And so you can have reactions to any medication you take. To be honest, you can have an allergic reaction to any type of medication, and so that's something important to remember. With the COVID vaccine, important things to remember for anyone that's scared or nervous about having allergic reaction is that you are monitored. You're going to be in a hospital setting. If you're at all worried, if you have allergies and you're worried and you've had allergic reactions to other medications, then you should always talk to your allergist before, and sit down with them and see what your history is and if there's anything to be worried about. So I guess my take homes from that is that allergic reactions are possible to any medications. You will be in an environment where if you have an allergic reaction, you can get treated appropriately. And we do know how to treat allergic reactions. When people get shots in my office for their allergens, because I'm injecting them with something that they're allergic to, there is the potential to have an allergic reaction. And so treating anaphylaxis, or treating the beginnings of anaphylaxis, is something that doctors are very familiar with. So it's not something that's new. It's not something that we don't know how to manage.
Great. Thank you so much for that information. I think a lot of us have been wondering, especially like you said, it's a hot topic. So we're glad to have some information about that. Another question that was asked was, is there an opportunity for PAs or NPs in allergy and immunology? Do you work closely with them? Or if not, is there can they get into that field as well?
Yes, absolutely. So one of the practices that I initially started working with when I came back from my sabbatical, I had a physician assistant working with me who is one of my best friends now. She's amazing. The thing with physician assistant is you can switch around in different fields. You can gain experience in whatever field of medicine you want to be in. So both nurse practitioners and physician assistants can work within allergy and immunology. And in general, just speaking to physician assistant and nurse practitioners, you can essentially, whatever interest you have, you can work within that field in both.
Great, thank you so much. We had a really interesting question from Selena. And the question is, with an increasing appreciation for how human microbiota modulate immunity, how do you foresee the new microbiological treatment will be more widely implemented in allergy medicine in the future? For example, fecal transplants. I know that it's also common for C-section born babies to be seeded with vaginal tract microbiota upon birth, so stuff like that.
Sure. So again, this is one of the newer newer areas in medicine that is actively being researched. And I think the immune system and gut health, for example, are very linked. And I think we're learning more and more about that. I personally, again, like I said, within any field, you can kind of become specialized in that particular arena. I think this is a newer kind of aspect of medicine that's coming into fruition, but it's very new, and I think we're learning more and more. And as far as, you know, the vaginal seeding, that is something that I thought about because I was pregnant and having a baby, and I ended up having a C-section. And so, you know, the vaginal seeding, and kind of giving your body some of that kind of exposure to the vaginal flora that they might not be exposed to if they didn't have a vaginal delivery. Again, there's data that goes both ways, that it can be helpful, maybe it's helpful, we're not really sure. So it's not definitive necessarily. So it's really one of those things that isn't done all the time. It's more of something that you can request if it's something that you're interested in as with your doctor. You can talk to them about that. So I hope that was helpful. I'm not a specialist in that particular topic.
Thank you for giving us what you do know. So thank you. That's awesome. We had a lot of students really more interested in knowing if you had to apply as or considered an international student when applying to medical school, and if so, did that impact any of your opportunities and what schools you could go to, or also just how you traveled internationally for your medical opportunities?
Sure. So, you know, I was born in Africa, but I essentially grew up in America. So I did all of my education in America. I went to you guys saw, I went to high school, undergrad, medical school, did my residency. I did all of my education within the United States. So I would not be considered a foreign medical grad. But for example, my dad was a foreign medical grad. He did his education in India and then came here and did his residency. So I think that that's what the question was kind of. And then the second part of the question was, how did I travel? Was that it? Sorry.
Yeah, so there was just a lot of questions about if you think that it would have impacted you for traveling purposes, but since you're considered not an international student, that answers the question.
Yeah. So I'm an American citizen, so I don't have that problem, unfortunately, or fortunately, but yeah, it might impact, I think, visa issues and things. Like, you would definitely have to look into that. Mm-hmm.
Thank you for sharing your personal experiences. There was a really interesting question that a lot of people were wondering, and it was, I mean, you mentioned you're a new mother, and as a physician, what is your work-life balance like exactly, and how do you manage being a new mother, being a physician, and just having your own life aside from medicine?
Yeah, so that's kind of what I was talking about at the very end is, you know, life changes, your personal circumstances change. You know, like I said, with COVID, a lot of stuff changed for a lot of people. And then during COVID, being a new mother, and thinking, and then kind of figuring out, you know, there are a lot of my friends who are not new mothers necessarily, but are mothers and are practicing medicine while also, you know, coming home to their kids every day during the pandemic. So it is possible, but like for me personally, you know, having an infant and in this situation, I, again, was lucky in that right now I am working from home, and I am essentially creating and running a company from home. And so it's a lot of Zoom meetings. I'm on Zoom a lot. It's a lot of, and then it's a lot of seeing patients. There's different ways to see patients through telemedicine. And right now we're doing asynchronous consults, which means I'm not getting on Zoom with my patient, but I am, I'm getting their information and I'm messaging back and forth with them. So, you know, essentially my work-life balance has been really, really great right now because I've been able to be at home, but it's not easy. It's not easy to take care of you know, I've been taking care of him alone, completely alone by myself. So I'm a full-time mom and also working full-time. So it's a lot. And I think a lot of you are probably younger, I'm assuming, and probably not at that phase of your life, but But when you are, I think, reaching out to colleagues and reaching out to mentors and finding out ways that they made it work is super important and will be helpful.
Great, thank you so much. And the last question that we're going to wrap up with before we let you go is, with this pandemic still looming over us, and as college pre-med students in this time, what last piece of advice would you leave us with?
I think, I think that there's still ways to interact with doctors, even though we're in the middle of a pandemic. This is one great way that you guys have created. I'm really, really impressed by what you guys have done. It's a great model. It's a great way to kind of connect students with physicians that are willing to, connect. And so, you shouldn't be afraid to reach out and say that you'd like to, do a project or be involved in something that the person's working on. Another thing that I didn't mention is I have a podcast on allergies called The Itch. And so, if there's so many ways that you can be involved with for me, for example, I always have interns. So if somebody's interested, and I mean, I can't have 200 interns, but if somebody's interested in, in doing like a side project with me and helping me with a project and learning more about, doing a podcast in medicine, or, what is it like to do telemedicine or whatever, I'm more than open. And I think other doctors are too. So I think with Instagram, there's pros and cons to social media, but I think one of the pros is that you can reach out to any of the doctors that you're following on Instagram. And if you like something that they're doing, if you're interested in helping or providing, I think the thing is that you have to remember there has to be, everybody is busy. Everybody's trying to manage this work-life balance. And so, sometimes taking on a student can mean taking on an extra project. And so I think just recognizing as a student that doctors are more than welcome to have interns and people that are interested and want to learn more. But there has to be that like kind of relationship building and figuring out how you can be involved in a project and how both people can, I guess, benefit in a certain way, if that makes sense.
Yes, thank you so much. We loved your experiences and the personal aspect of being a physician, especially during a pandemic. So thank you so much for sharing that with us.
You're welcome. You're welcome.
If you can, I don't know if you can see the chat right now, but it's just everyone saying thank you and blowing up.
Oh, that's sweet. Oh, sweet. Yeah. So, so I'm here for you guys. It's going to be okay. We're going to get through this. And I think that, you guys just have to be creative right now. And everybody knows that there's a pandemic. Everybody knows that you might not be able to have like 20 different things that are on your resume. And just one other point that I want to leave with is that you don't have to do a million things, okay? You don't have to do a million things to get into medicine. You, at the end of the day, you should do what really makes you happy and what fulfills you. And it shouldn't just be something that's on your resume. And that shouldn't be the reason that you're doing something. Because at the end of the day, people can see through that. And so just remember to relax, do good on all your exams, learn what you need to learn right now. And then if there's something that you're interested in, a side project, get involved in it. But you don't have to. And I have a really hard time with this because I'm involved in way too many things. And so sometimes I think we are all type A personalities and we have that tendency to want to do everything. And so, so just remember to slow down, take a step back, and there's time to be involved in so many different things at different times in your life. And so you don't have to do it all right now.
Thank you so much. I know a lot of people needed to hear that, us included. So thank you for that.
You're welcome.